COVID-19. What is it? It's a virus that has spread throughout the world, having its origins in December 2019 and is transmitted from person to person. It mainly affects the respiratory system in most cases. How does the COVID spread? By droplets expelled through coughing or sneezing. Other people inhale as they fall on surfaces such as door latches, elevator buttons, cell phone screens, among many others. We should not touch our eyes, nose, or face so that the virus does not penetrate our body. Asymptomatic transmission. It usually happens between 2 or 14 days after being exposed to the virus, and we do not realize that we can be contagious. That is why it is recommendable to isolate ourselves during that period of time. Symptoms: fever, cough, body aches, and trouble breathing. Some could be headache, sore throat, runny nose, nausea, and diarrhea. The most vulnerable are people 65 years old or more or who have lung disease or diabetes. What should I do if I am concerned that I have had exposure? This is if you were within a distance of fewer than 6 feet with another infected person. If you have traveled to a place where there has been a considerable number of cases, or you were in a very crowded event. If you believe that you have had contact with an infected person, notify your health personnel and provide the necessary data to trace the source of the infection and to avoid spread by isolating the environment. If you have fever or a cough, you should report it too before going to the hospital. You may be asked to enter through a designated door. What can I do to avoid getting sick? Wash your hands with soap and warm water for 20 seconds. This is because soap breaks down the capsule that surrounds the virus and eliminates it. Dry it off with a paper towel and turn off the tap with the same towel. If there is no soap, then use a disinfectant that has 60% ethyl alcohol. How to use the mask correctly. Cover both the nose and mouth, hooking the ears or placing the elastic separately at the nape. Also check that the mask covers the chin area and then tightens the metal or plastic nose clip to make it airtight. Move it from behind without touching the front. Fortunately, thanks to specialized scientist studies, the Pfizer lab has created the long-awaited vaccine that could reduce the risk of infection. It is already being dispensed in large part of the world population. That we are vaccinated does not mean that we should stop using masks. You have to continue taking care of yourself and others.